So today I'm going to explain BrainSight, which is the stereotactic neuronavigation equipment that we have available here at Auburn for surgeries. It is a computer-guided way to conduct surgeries extremely accurately, whether we're talking about surgery of the brain or surgery of the spine or even surgery of the nose. The basis of the system is a computer software platform, which is here, an infrared camera, and then the patient itself, which in this case is a plastic model of a skull that we did a scan of. So when we have a patient that has disease in one of those areas that we identify and the owner wants to pursue surgery, which sometimes can be dangerous, we try to do it as accurately as possible, which this equipment lets us do. So we scan the patient first, which we did to our plastic skull, and then we take those images from the scan, whether that's a CAT scan or an MRI, and we import it into our computer system, which I've done. And then once we've got that material in our computer system, we can paint areas of interest and create 3D models of what we're interested in. So if we want to biopsy a tumor, for instance, in the brain, we can outline the margins of that tumor in 3 dimensions, outline the skull of the dog, and even the skin of the animal, so we know where we are in relation to the scan. So the reason that this technology is really unique is it's one of the only ones that was actually created with veterinary patients in mind. So all of the other systems that are available on the market are actually designed for humans, and then we have to adapt them to veterinary patients as opposed to being designed for veterinary patients from the first. So now we've created a 3D model of our skull, which you can see is also on the table here. And I can rotate this model in 3D space to see where it lays. The biggest thing that this is helpful for is any brain disease where previously the lesion or the disease was small. We wouldn't necessarily be able to access it without interfering with a whole bunch of normal brain. And so with this system, I can pinpoint something as small as 2 millimeters and shoot straight at it with accuracy and going through as little normal tissue as possible. The other place this is very helpful is in actually defining the landmarks of a bigger surgery. So you know that you want to approach the tumor, you know the tumor should be in a certain area. With this equipment, you can actually direct everything from where you make your first skin incision to where you actually take the tumor out from your images. The green marker is where I am holding this pointer. So now when I hold my pointer over this eye, you can see there it is on the screen. I can come up to the front of his nose, check there on the screen as well. I can come back out to one of those landmarks, and there we are in the center of the landmark. Once we check our accuracy, the next thing we do is we actually use this in the OR to guide the surgery. So we can see where we are, and if we've created an X marks the spot or a target, we can see how accurately we're hitting the target, and that's the real way we do biopsy within millimeters of accuracy.